Today, we start with the exercise. Exercise is physical activity that's planned, structured, and repetitive for the purpose of conditioning the body. Exercise consists of cardiovascular conditioning, strength and resistance, training and flexibility. Purpose: exercise is essentially for improving overall health, maintaining fitness, and helping to prevent the development of obesity, hypertension, and cardiovascular disease. Surveys conducted by the Centers for Disease Control and Prevention indicate that 61.5% of children aged 9 to 13 years do not participate in any organized physical activity. For example, sports, dance classes, and 22.6% are not physically active during their free time, according to American Obesity Association. Approximately 30% of children and adolescents aged 6 to 19 years are overweight and 15% are obese. A sedentary lifestyle and excess caloric consumption are the primary causes of this increase in overweight and obesity. Regular exercise is considered an important factor in controlling weight. Overweight and obese children and adolescents are at high risk of developing several medical conditions, including the following: asthma, diabetes, hypertension, orthopedic complications such as hip and knee pain, and limited range of motion, cardiovascular disease, high cholesterol, sleep apnea, psychosocial disorder such as depression, negative body image, and eating disorder. Clinical studies have shown that regular exercise has numerous benefits, including the following: preventing weight gain and maintaining health weight, reducing blood pressure and cholesterol, improving coordination, improving self-esteem and self-confidence, decreasing the risk of developing diabetes, cardiovascular disease and certain types of cancer, increased life expectancy. Now the description. Exercise consists of cardiovascular conditioning, strength and resistance training, and flexibility to improve and maintain the fitness of the body's heart, lung, and muscles. Cardiovascular conditioning. Cardiovascular conditioning involves moderate to vigorous physical activity that results in an elevated heart rate for a sustained period of time. Regular cardiovascular exercise improves the efficiency of the functioning of the heart, lung, and circulatory system. For adults, aerobic exercise within a target heart rate range calculated based on a maximum heart rate by age is recommended. For healthy children, cardiovascular exercise that elevates the heart rate to no greater than a maximum heart rate of 200 beats per minute is recommended. In general, the American Heart Association recommends at least 60 minutes of moderate to vigorous physical activity every day for children and adolescents. Cardiovascular conditioning activities should be appropriate for the age, gender, and emotional states of the child. Examples of exercise that elevates the heart rate are bicycle riding, running, swimming, jumping rope, brisk walking, dancing, soccer, and basketball. Strength and resistance training. Strength and resistance training increase muscle strength and mass, bone strength, and the body metabolism. Strengthening exercise increases muscle strength by putting more strain on a muscle that is normally accustomed to receiving. Strength training can be performed with or without special equipment. Strength resistance training equipment includes handheld dumbbells, resistance machine, and elastic bands. Strength training can also be performed without equipment. Exercise without equipment include push-ups, abdominal crunches, and squats. Children as young as 6 years can participate in strength training with weight, provided they are supervised by a fitness professional training in youth strength training. Child-sized resistance machines may be available at some fitness facilities. According to youth strength training guidelines, children and adolescents should perform strength training for approximately 20 minutes, 2 or 3 times weekly on non-consecutive days. Now the precautions. Before a child begins an exercise program, he or she should be evaluated by a physician in order to rule out any potential health risks. Children and adolescents with physical restrictions or subtle medical conditions may require an exercise program supervised by a healthcare professional, such as physical therapist or exercise physiologist. If dizziness, nausea, excessive shortness of breath, or chest pain occur during an exercise program, the activity should be stopped and a physician should be consulted before the child resumes the activity. Children and adolescents who use any type of exercise equipment should be supervised by a knowledgeable fitness professional, such as a personal trainer. Now the precaution. A physical examination by a physician is important to determine if strength exercise is appropriate or detrimental. Prior to beginning exercise, a proper warm-up is necessary to help prevent the possibility of injury resulting from tight muscles, tendons, ligaments, and joints. Appropriate warm-up exercises including walking, light calisthenics, and stretching.